Hello, my group did our presentation on orthopedic impairments. To start, an orthopedic impairment is a severe impairment that adversely affects a child's educational performance. The term includes impairments caused by congenital anomalies, impairments caused by disease, and impairments from other causes. This impairment is considered a low incident disability, meaning that less than 20% of all the students with disabilities are in the low incidence category, meaning that as an educator, you will most likely encounter only a few over the course of your career. Orthopedic impairments are physically disabling conditions that affect locomotion or motor functions. As previously stated, they can be the result of a congenital anomaly, disease, accident, or other cause. And in order to fit into this category, students must be adversely affected in their educational performance. Out of the 54,382 students with low incidence disabilities receiving special education services in the 2011 to 2012 school year, only 0.8% of students ages 6 through 21 had an orthopedic impairment, and they made up 0.94% of students receiving IDEA services. Orthopedic impairments can be caused by a birth defect and be present all of the student's life or be a result of accident or disease. Examples of an orthopedic impairment that may have been caused by a birth defect include spina bifida, clubfoot, brachial plexus or Arab palsy, or the absence or malformation of a limb. Examples of orthopedic impairments caused by disease could include muscular dystrophy, arthritis, childhood obesity, poliomyelitis, or bone tuberculosis. Other orthopedic impairments that come later in life could be caused by fractures, which cause immovable or stiff joints, also known as contractures. The IDEA category of orthopedic impairments contains a wide variety of disorders. These can be divided into three main areas: neuromotor impairments, degenerative diseases, and musculoskeletal disorders. Neuromotor impairments are the abnormality of or damage to the brain, spinal cord, or nervous system that sends impulses to the muscles of the body. These impairments are acquired before birth, affect multiple body systems, such as limiting limb movement, causing loss of urinary control, and loss of proper alignment of the spine. And the most common disorders are spina bifida and cerebral palsy. Cerebral palsy is the most common orthopedic impairment seen in the educational system and refers to several non-progressive disorders of voluntary movement or posture that are caused by malfunction of or damage to the developing brain that occurs before or during birth or within the first few years of life. Individuals with cerebral palsy have abnormal, involuntary, and/or uncoordinated motor movements. There are four specific classifications for cerebral palsy: spastic, which is very tight muscles occurring in one or more muscle groups that result in stiff, uncoordinated movements; athetoid, movements are coordinated, abnormal, and purposeless for this category; ataxic, which means that there is poor balance and equilibrium in addition to uncoordinated voluntary movement; or mixed, which is any combination of the other types. Cerebral palsy may also be classified by which limbs are affected, whether the left or right side, whether the legs are affected more than the arms, whether the legs are only affected, or if all four limbs are affected. Another neuromotor disorder is spina bifida, which is characterized by an abnormal opening in the spinal column and frequently involves some paralysis of various portions of the body. It may or may not affect intellectual functioning. It has two classifications: Spina bifida occulta is the mild condition, and spina bifida cystica is more serious. The next category of orthopedic impairments is degenerative diseases. Some examples of degenerative diseases include Alzheimer's disease, cancer, and muscular dystrophy. Muscular dystrophy affects the motor development of students and is most often seen as muscular dystrophy in the school. The next category for orthopedic impairments is musculoskeletal disorders. Some examples include juvenile rheumatoid arthritis and limb deficiency. There are various conditions that have various levels of physical limitation on students. For most students with orthopedic impairments, the impact on learning is mostly focused on accommodations for students to have access to academic instruction. They do not often have cognitive issues joint with the musculoskeletal disorders. The impact of one of the three disorders depends on the severity, the disease itself, and individual factors. Even identical diagnoses can appear different among individuals. For most students with orthopedic impairments, the impact on learning is mostly focused on accommodations for students to have access to academic instruction. Many of these students' diseases and disorders have no effect on their cognitive abilities, but individuals with neuromotor impairments have a higher incidence of additional impairments, especially when there has been brain involvement. Some examples of accommodations that students may receive in a classroom include special seating arrangements to develop useful posture and movements, instruction focused on development of gross and fine motor skills, securing suitable augmentative communication and other assistive devices, and awareness of medical condition and its effect on the students, such as if a student is more inclined to get tired quickly. Some specialists who may be involved with a student with an orthopedic impairment include physical therapists who work on gross motor skills, focusing on the legs, back, neck, and torso, occupational therapists who work on fine motor skills, such as focusing on the arms and hands, as well as daily living activities such as dressing and bathing, speech and language pathologists who work with the student on problems with speech and language, adapted physical education teachers who are specially trained PE teachers that work along with the OT and PT to develop an exercise program to help students with disabilities, and other therapists as needed, such as massage and music therapists. Depending on the severity of the orthopedic impairment, students may need to utilize assistive technology, including devices to access information. These assistive technology devices focus on aiding the student to access educational material and may include speech recognition software, screen reading software, augmentative and alternative communication devices such as communication boards, and academic software packages for students with disabilities. Other devices that may be used for an orthopedic impaired student include devices for positioning and mobility. These assistive technology devices focus on helping the student participate in educational activities and include canes, walkers, crutches, wheelchairs, specialized exercise equipment, specialized chairs, desks, and tables for proper posture development. There are many organizations that lend support and do research on orthopedic impairment, including the National Multiple Sclerosis Society, United Cerebral Palsy, United Spinal Association, Cerebral Palsy Guide, and the Muscular Dystrophy Association. Ultimately, the main thing to keep in mind with any students who have orthopedic impairments is to treat them as you would any other student and to make sure that you include them as much as you can in your classroom. These students often do not have cognitive disabilities as previously stated, so there doesn't need to be necessarily as much of a change in um, the way you teach. Many of the changes are going to be in your classroom setup and any activities that may may need students to get up and move around. But that is our presentation on orthopedic impairments. Thank you.